Hello, I'm Joe Muscolino, and I'm going to show you a stretch that I like to call the lateral line stretch of the hip joint. It stretches the musculature and other soft tissues that cross laterally the hip joint, which means basically gluteus medius, gluteus minimus, TFL, sartorius, posterior fibers of gluteus maximus. These muscles are abductors of the thigh at the hip joint, or they're depressors of the pelvis at the hip joint. To stretch them, we have our client side lying on the table, and we have them lie diagonally across the table this way, so her shoulder is close toward the other side of the table, but her rear end is far toward this end of the table. This allows me to take her thigh and drop it back off the table without the thigh hitting the table itself. If I'm going to stretch the abductors of the hip joint, to do that, I need to keep the pelvis stable or fixed. Now, I could press with my hand and press like that, bring the thigh off, drop down with my right hand on the distal thigh, and press cephalad upward with my left heel of my hand, palm of my hand that way. But if that's uncomfortable for the client to have that much pressure on the pelvic bone, which it very often is, then it helps to have a cushion. So I can take this cushion, and I could use my hand, or I could even use my forearm, and then I can lean my body weight in here, because really the harder part of a stretch is not what you're stretching, it's the stabilization of a body part that is part of the stretch, in this case stabilizing the pelvic bone. So I've got you right there. And now I lean my body weight in to stabilize her pelvis. And just gravity, for some people, will do a very nice stretch for the abductors here. But if I then press on the distal thigh, I would never press on the lower leg itself, because that would put a torque force in through the knee joint. And I could just drop down with body weight and create the stretch. Now, if I wanted this stretch to not be isolated to just the hip abductors, but to include lateral flexion musculature here, such as the quadratus lumborum, then I would want her pelvic bone to move, and I would want to stabilize instead her rib cage. Here it's very important to not put pressure on just a rib, because you might pop that rib. So it's very important here to have some type of a cushion. I'm going to take your thigh here again, drop it off. Now you just drop down. We'll start with gravity. Gravity drops her thigh down. If I keep her rib cage stable, the stretching is now across the abductors and up through lateral flexors, quadratus lumborum, for example. Then I augment the stretch by pressing down. I could increase the stretch to even be into the intercostal musculature here, in which case I would let her rib cage move, I would not stabilize it, and I might hold her shoulder girdle here, and that you usually can do without a cushion. I stabilize her shoulder girdle by leaning my body weight in cephalad. I drop down, and now the stretch goes from hip abductors to trunk lateral flexors up into intercostal musculature. I could even augment this stretch geographic-wise on her body. Can you take your right hand and hold on to the end of the table? And now, if I press down here, the stretch goes across her entire lateral line up through her upper extremity. A couple of notes on doing a stretch. You have a choice when doing a stretch whether you want to hold the stretch, the position of stretch, for a prolonged period of time, 10, 20, 30 seconds, maybe do 3 repetitions, or you could do it more dynamically where you hold a position of stretch for maybe only a second or 2 or 3, but do more repetitions, perhaps 8 or 10 repetitions. That's your choice on the style of how you want to do the stretch. I'm Joe Muscolino, and this is the lateral line stretch for the hip abductors, as well as other lateral line musculature and soft tissue on the lateral side of the client's body. Thank you.